You're listening to the Veterinary Innovation Podcast. You're listening to the Veterinary Innovation Podcast, and my name is Shawn Ivan. Today, along with my awesome co-host, we've got a great guest. Really excited to talk about marijuana. Ivan, get us in here. Let's get started.
Sweet. So my name is Ivan Zach, and I'm happy to introduce you guys to Steven Cital. He doesn't need an introduction. Everybody knows who he is. He is the co-founder, although he claims he's not, of Anesthesia Nerds group that has 42,500 followers and members at the moment, which is pretty crazy. This is how I found about Steven. And then recently he became a director of education and development at ElleVet Sciences, which is bringing cannabis into veterinary world, and he's an executive director of Academy of Laboratory Animal Veterinary Technicians and Nurses. He is also co-founder of Veterinary Cannabis Academy. Pretty cool. On the personal side of things, he originally wanted to become a human nurse, and last time I checked, you said it was gross and you decided not to do that.
Yeah, people are dumb. Yeah.
And then started working in the veterinary field when he was in high school, and he performed relief work in Oakland Zoo and San Francisco Zoo. He enjoys dancing, hiking, reading, and teaching, and from what I know, occasionally drinking. So what it was like to work at the zoo?
The zoo was really, really fun. I did that as kind of a meditation. You know, the regular clinic can be quite stressful. You're dealing with owners, you're dealing with really, really sick animals. And the zoo, I got to use all my skills as a technician and as a practitioner to play with these awesome, crazy, exotic animals that usually were less sick, and we didn't have to deal with the crazy pet owners and the normal drama that we would experience in the clinic. So that was just for pure fun. I loved it. I was even taking poor pay. You know, one of my big things that I try to educate veterinary technicians on now and veterinary professionals in general is to not accept these low wages anymore. But that was my own fault there with taking low pay at the zoo, just because it was therapeutic for me to restart my brain and get me out of sticky situations that I may get in veterinary clinics.
I just want to jump in. I mean, this is such a cool topic, the cannabis, and a little bit of a story. If you could give us, how did you kind of transition from the anesthesia and the whole world in there? And then how did you go into cannabis, and how did you become passionate about bringing that into veterinary medicine and bringing the awareness and education into our profession?
Yeah, absolutely. So the cannabis stuff all started with the anesthesia and pain management side of things. So that's kind of what I think I'm best known for is anesthesia pain management stuff and education. And then I started having pet owners ask about cannabis products for their animals that were really, really painful. Maybe they are in a palliative care situation, so they're dying of cancer, they're dying of some other disease, and they just want to keep their pet comfortable. And so, you know, with those palliative care situations, I was like, well, they're going to die anyway. So if you want to try it. Be really careful with THC. That's the molecule that gets people and animals high. But why not? If it seems to be effective in people, we had preliminary research at that time suggesting that was going to be effective. So why not? And then seeing the success with these pet parents that had these really sick or dying animals, not euthanizing maybe on the date or the time period that they had set to euthanize their animal for quality of life issues, I'd ask them, hey, what's going on? Why haven't you euthanized your animal? Not that I'm pressuring you to, but they would often come back and say, my animal's doing great on these cannabinoid products, mostly CBD products, sometimes lower levels of THC in them, and their quality of life has improved significantly. So we don't feel the need to euthanize at this point. And so I was like, well, you know, not that I'm a veterinarian and can prescribe or dispense or anything. A lot of these products are marketed as a supplement. So I was like, well, I can talk to you safely about that, and started researching and discussing it with clients that had pets that were really, really painful or anxious or weren't necessarily going to be euthanized. And again, saw this really great success. And so it just really triggered me to dive deep into what's called cannabinoid medicine, figuring out the pharmacology, the safe dosing, kind of the harm reduction approach when discussing cannabis type products with pet owners. And just like anything I get myself into, I just became really passionate about it. I thought it was a really cool subject. It's not something that's taught in vet school, in tech school. It's barely taught in human medical professional schools. So just fell into it and became a canna nerd. I think Tasha would get mad at me if I added nerd to something else other than anesthesia, but
She holds the brand, right?
She does.
Can you talk about some of the most insightful or kind of amazing cases where cannabinoid oils have been used?
Yeah, so some of the coolest cases I've seen, and I have to be careful because I am at a director level with a hemp CBD company, so I have to be careful with what I say because this is a unregulated industry so far when it comes to CBD products and cannabinoid products in general, in particular from hemp products, not necessarily marijuana products, which is still a Schedule I drug at the FDA level and DEA level. So some of the really interesting cases that I've seen so far are really those cases with the old animals that have had cognitive changes, right? So as an animal gets older, just like our grandparents, they get a little fuzzy. Maybe they're a little bit slower. They're slow to recall, maybe slow to do some of the tricks that they were once so good at, and then physically slow as well, getting up the stairs, not wanting to run around or be active and engage with you as much anymore. I have just seen amazing stories when starting to use these CBD products and waking them back up again. You see the brightness in their eyes come back. You see them acting like a puppy. I actually had a colleague of mine named Annette, and she had this little Chihuahua dog that totally senile old dog would walk in circles and pace all the time. And I said, hey, why don't you try this product? So I gave her some of the ElleVet stuff because I had a bunch of samples of it. And I gave it to her. And the next day she came back to work and gave me the bag of treats back. And I said, what happened? And she was like, my dog was acting like a puppy and wanted to play in the middle of the night. So I had to lock her in the laundry room because she was annoying me. So I don't want to give her this stuff. I'm like, but Annette, that's a good thing. You want her to be normal again. She's like, no, it's a hassle. It's inconvenient for me. I'm like, oh my God.
Let's
keep her
a little sick.
Yeah, it's a great story because it really just shows the power of the stuff and being able to kind of bring these animals back.
That example, was that CBD or was that THC or a blend or what was that?
That was what's called a broad spectrum product. So it does have CBD and all the other molecules that the plant has to offer, but has a very low amount or trace amounts of THC in it.
Okay.
Certainly if it was like a THC dominant product for the first couple of doses, maybe first couple of weeks, we would definitely see some lethargy, some more classic THC symptoms that we would see in dogs and cats and people. So that was definitely a CBD dominant product.
And then the next question is, do dogs get the munchies?
Yes, that is a great question. And we certainly have a lot of anecdotal evidence and suggestion. And we are doing studies now on utilizing these types of molecules to increase appetite, not just the munchy state, which is usually short-lived, but generally increasing appetite for animals, in particular if the animal has some other sort of ailment going on. So things that people don't necessarily remember all the time, and certainly as veterinary professionals we're guilty of this, is just because an animal is not eating doesn't mean they're just not hungry or they don't have an appetite. Maybe they're not eating because they're painful. Maybe they are not eating because they are confused. They forgot where the food bowl was. They have this sundowner syndrome that we see in older people and animals, and they forgot where that food bowl was. So maybe it's not that they don't want to eat. It's just they're incapacitated at a cognitive level, or they just feel like shit. And these cannabinoids can make them feel better and make them want to eat. So it's not necessarily just an appetite thing, which we do know that these molecules have therapeutic effects on those centers, but just a holistic approach to the animal.
So do you see the application of this in something like in an emergency room department or in the recovery phase when the appetite is suppressed? Like, is that something that people are trying already, or?
Yeah, so the best success as far as using cannabinoid type products in conjunction with typical therapies or in more acute settings is certainly for like our cancer patients. So, everyone wants to use cannabis type products to cure cancer. So we have to be careful there as far as my affiliations with a supplement company, but also just the science that we have so far. And we are doing research, and ElleVet Sciences has sponsored an in vitro study and now in vivo study looking at 3 different cancer cell lines: lymphoma, mammary carcinoma, and osteosarcoma. And we are finding cell death, which is really cool and exciting, but also using these molecules in combination with traditional therapies like chemotherapy. Can we minimize some of the inappetence, some of the just crumminess that these animals may feel after large dose or acute dosing of chemotherapy agents? We also have another study going on right now for the acute pain patient. So the model is TPLO, so post tibial plateau leveling osteotomy surgery, in lieu of using things like traditional nonsteroidal anti-inflammatories and maybe even cutting back or even completely cutting out opioids, which is obviously a crisis of ours down in the United States, which I think is really interesting. And then the other really interesting thing that I think is going to take a while for veterinary medicine to accept and catch up on is using CBD, whether it's an isolate or a very CBD dominant product, to actually antagonize and reverse THC toxicity. So THC toxicity is something that we've seen a 500+% increase since legalization in the United States, or several states that have legalized marijuana, because animals are getting into their parents' edibles or whatnot. CBD has antagonistic effects for THC. So when we give a high dose of CBD to an animal that has just ingested a bunch of THC, we can actually reverse some of those super stoned effects that we would see in dogs and cats.
Wow, that's amazing. I didn't know that. That's really interesting. So the CBD versus THC, sativa, I think there's another word that I'm missing.
Indica.
Yeah. Can you give like our listeners like the basic kind of rundown? Because I think a lot of people are probably listening and maybe smoked marijuana once in university, but don't really understand all of the new lingo that is kind of all of a sudden.
I like that you're very specific in university. Is this a Canadian thing? Like in university,
So I will admit, I am an avid marijuana, cannabis, hemp user, like every single day. I usually use a THC product to sleep, to aid in my sleep. And it's funny, I travel so often, and there's been a couple of times where I didn't bring anything with me, and I have a lecture the next morning, and I am just tossing and turning, and I'm so uncomfortable because I'm just not getting that sleep quality I normally would get when I have that THC on board. But some of the things that we're going to have to really start defining as clinical people and talking about these types of products in a clinical setting is getting away from the typical cannabis culture of calling different strains or different types of plants with different profiles things like strains, or calling it, oh, it's a sativa, or oh, it's an indica. The sativas are uplifting, where the indicas are more calming and better for sleep. So to me, as a science-based person, a molecule is a molecule. And when we start formulating these products for animals, I don't really care if it comes from a sativa plant or a plant that would be considered a sativa plant or an indica plant. I care about the total makeup of these cannabinoids in these products and their therapeutic effects on the patient that they're going to be given to. So the other thing that we get confused with as far as terminology is we call everything strains. Oh, what strain is this? Is this a better strain for, I don't know, cancer? Is this a better strain to make you go be more social or something like that? So strain is a more appropriate word for something like a bacterial line, not necessarily a plant. So when we're talking about different plants, we should be using the terms a chemovore or a cultivore instead of the word strain. So it's technically incorrect, but it's a hard cultural thing to overcome at this point.
That would be a cool word to use at the party.
Yeah. Oh, what cultivar is that? You said
is that before or after you smoke, Ivan?
Yeah, I mean,
definitely after. Definitely.
Depends on what I use. I may or may not be able to pronounce it at that point, but
a close friend of mine, he's in his 80s. He has chronic pain, And me and Ivan went to the Cannabis store in Halifax, which was an interesting experience for Ivan, I think, especially when we showed up in the Ukraine with the pictures of what looked like an Apple store in Nova Scotia, but it actually was a cannabis store. So I bought him this CBD oil because he's got this chronic pain and he's literally petrified to take it. I think he's going to his doctor this week with the CBD oil, and he's going to ask his doctor about it again, I think for the second time. And, you know, this man suffers like chronic headaches, chronic backaches. He's in his 80s, and I don't know if it will help him. You know, I just picked it up because he asked me to. But what have you seen in animals that may be kind of able to kind of shed some light on that particular situation that's on the human side?
So that's actually a pretty easy question to answer, and I can actually quote some of the human studies. So some of the human studies looking at chronic pain patients, where the people have been on maybe non-steroidal anti-inflammatories, or they've been on oral narcotics, so things like codeine and oxy and all these other things that have gotten us into this crisis. When they add things like CBD to their pain management protocols, we can see a decrease in the overall pharmaceuticals that they're taking by 30 to 70%. And in some of those populations, we have 100% of people that have just gotten off of those traditional pharmaceuticals and relied on these cannabis-based products instead, which I think is really cool.
And then what about the interplay between those drugs that they're on versus
Absolutely.
CBD? I think that's one of his, biggest concerns.
Yeah. And so on the animal side, again, the company I work for, we sponsored a study out of Cornell University, and they were looking at osteoarthritis in dogs and really old Gomer dogs that were on their last leg, no pun intended, and some of them were on non-steroidal anti-inflammatories, and we wanted them to maintain their regimen of non-steroidal anti-inflammatories while taking our product for the study. And what they found was a greater than 80% efficacy in decreasing pain scores for the animals that were on the test article group, so not in the placebo group, which I think is really cool. And what we also found is these products, even though they are also anti-inflammatory, or we know that part of their mechanism of action is anti-inflammatory, don't have negative consequences when mixed with non-steroidal anti-inflammatories, which is a rough concept for us as practitioners to kind of think about, because we've always been taught, never give steroids with an anti-inflammatory, right? A non-steroidal anti-inflammatory, but here we are giving two anti-inflammatories at the same time. We don't see renal effects and we don't see GI effects like we would normally see if we were to combine two other medications.
How about the side effects? So is it dose dependent as well? Because, as an ER vet, I'm familiar with the dogs with incontinence coming in and the teenage owner pretending that he doesn't know what's going on. Is this dose dependent, and how do you cope with those when you apply cannabinoids to a patient with a chronic pain or cancer patients? How do you manage that?
Yeah, so I wanted to touch on one more thing as far as drug interactions. When we start a patient on a CBD product and they're maybe on something like gabapentin, or if you're one of those old school vets that's still prescribing tramadol for pain for animals, we do see a little bit of extra sedation, maybe for the first week or two, until their body figures out, hey, I can metabolize these things, build up a little bit of tolerance to it. So that is a very common side effect that we see. And then side effects with these products alone are definitely dose dependent and they're patient dependent. So there's this theory called the endocannabinoid system tone. And so the endocannabinoid system is a series of receptors throughout our body. They're in our periphery, they're in our CNS. And depending on how many endocannabinoid receptors you have, and how many of them are maybe empty and not holding what's called an endogenous cannabinoid, so a molecule that your body produces, we can see varying effect from patient to patient, especially if they have a pretty severe inflammatory disease already. Maybe their body is fatigued and not producing these endocannabinoids as much, so we see better effect when we start to supplement them with these plant-based molecules. So it is going to be variable. And that's why we always tell everyone to start low and go slow. If we're not seeing the effects at the dose that we immediately tell you to start at, then we know we can safely increase them. And we increase until we see the desired effect.
Okay. So this is a little unfamiliar area for me. So there are receptors that are specific to cannabis in the body. So let's say like if we talk about hydro and opioids, there's, mu, kappa, gamma, and all those things. And then there's naturally produced cannabinoids, and then that's why we're targeting those with these new drugs. And which is fascinating. Not something we learned in school. We did more the Shawn's version in university, so sort of self-taught. But this is very interesting.
Yeah, so it's cool because the endocannabinoid system is actually one of the largest receptor systems that we have in mammalian physiology. And it's just so weird that we never learned about it in school. And what's also cool is we now know some of the medications that we use every single day in practice also work on the endocannabinoid system. Propofol and ketamine specifically work on the endocannabinoid system. And I always tell people, I have no proof of this, so no one quote me or put this in lecture notes or whatever, but we know that propofol, when given in short boluses to patients, can induce for a short period of time the munchies. I suspect, I'm postulating that, hey, maybe it's the part of the endocannabinoid system that creates munchies when we consume THC that's creating this short-lived munchie syndrome that we see when giving propofol, which I think is really cool. The classic system is comprised of two different types of receptors. There's called a CB1 receptor and a CB2 receptor. And then there's also another receptor that's called an orphan receptor. It's another G protein coupled receptor, number 55, that is also really receptive to these molecules from the plant.
That's fascinating. So with the abuse, historically of other drugs that historically were pain control, like opioids, and then abused for recreational and addiction, do you see any evidence, and is there any evidence that the doses of, in human, I guess, because people do abuse cannabis or use, I shouldn't say abuse, some use, some abuse.
some do abuse, I agree.
With a regular use, if you do end up with a chronic pain when you have to use it, do you have overwhelmed sort of system? And I don't know if your liver with the P450 is adapting to it more and your doses are starting higher. Do you see a resistance? And I don't know if there's dogs that abuse it, and there's probably occasional exposure, but in general, is there evidence that would be sort of competitive, or is there a depletion like with the serotonin when you need to use it?
Yeah, so those are really great questions, and there's probably like 10 different tangents that I could talk about with the stuff you brought up. So as far as a tolerance buildup, what we know from the literature so far is you can have a tolerance to the euphoric or the psychotropic effects that THC specifically produces. In the rodent model, we do not see a tolerance to the pain relieving or anti-inflammatory effects of things like the other minor cannabinoids, so things like CBD, CBDA, CBC. As far as serotonin is concerned, that is a new lecture topic I'm actually going to be talking about soon, because we know that these cannabinoids also have affinity or allosteric modulation. So they sit on the side of the receptor and still activate it with dopamine and serotonin receptors specifically. So if we have a patient that's maybe on SSRIs or SNRIs, maybe we do need to be a little bit more careful. So if they're on these max doses of trazodone, maybe if they're on trazodone and tramadol together already, where we're cautious and nervous about creating serotonin symptoms specifically, adding a cannabinoid product may or may not be a good thing for that patient. And we're really going to have to play with the dosing and maybe consider getting them off of one of those pharmaceutical drugs, because we just don't know how that's going to react in veterinary patients at this point. So far, it looks pretty safe. But with that, we're still in the infancy of this research.
Cannabis has been so demonized, especially if you look in the US, depending state by state, which one you're in, it's been so demonized. And so has that had any negative impact on you as a professional, like when people kind of associate you with cannabis?
Yeah, so I guess one of my claim to fame is being a little bit edgy in general. So, I just was interviewed for an article that came out, the Scourge of Discrimination. It was an article written about diversity issues in veterinary medicine by Sarah Rumpel, which is a whole other topic. But I've always been a little bit edgy. And so I think people that know me know to expect that. that. And certainly, as far as what it's done for me professionally, it's only elevated me professionally without sounding too haughty and trying to sound full of myself. But, I'm speaking at 20 to 30 conferences a year specifically on this topic. People are so hungry for it. So it certainly hasn't taken away any business. But it is something that we really need to reevaluate. The government for such a long period of time has scheduled cannabinoids in general as a Schedule 1, which means they have no therapeutic effects. Which means you have to have special permitting to actually do research on them. Yet the federal government in the United States has multiple patents on these cannabinoids and different profiles for medical uses. So it's a bit hypocritical, and it's definitely a little bit of a conspiracy theory thing that I have going on. But it's only opened doors so far. And I think that we as a medical community also need to be receptive to this. I was just looking at a diagram of different pharmaceutical companies that have patents for cannabinoid type products, and all the big players that we're used to seeing produce traditional pharmaceuticals that we have on our shelves in clinic, they all have patents. They are all developing these types of products. So whether you like it or not, it's going to be coming into this industry sooner or later at a more pharmaceutical level instead of a supplement level. So we have to prepare ourselves whether we want to or not.
Yeah, change is afoot. I mean, you look at what happened in Canada. I think it was October of last year when marijuana was legalized and started to be sold by government entities. And, I think the public opinion was that it was going to be pandemonium and craziness and stone people in the streets and, death and destruction. And, there was a lineup at the cannabis store for, I think, the first couple of days. And then seemingly it's just kind of disappeared, and it's, kind of settled into the Canadian culture as something that's just there. It's kind of bizarre and interesting. And I think it has actually created a lot of tourism in Canada. I think there's a lot of people coming from, America, the states that are
just like they did before turning 21 anyway. So
that's right. Yeah, exactly. For other things,
Yeah. And I have a Russian friend. She's, we have kids a similar age, and she's in Russia. It's all illegal. You go to jail and murdered there if you have a joint on you. And she was paranoid. And then she was like, oh my God, they're legalizing this stuff. Now everybody's going to drive high. And I said, well, the law is not about you being able to drive high. You shouldn't do that just like, when you're drinking. Yeah. It's not about that. It was so funny that she had this perception. I'm like, those people that were driving high, they will continue doing that. So don't worry about it.
And, the interesting thing when it comes to people using it, and in these states, I can only speak from the United States living here, but the statistics that we're finding as far as people harming themselves or harming other people when they're under the influence of cannabinoids compared to alcohol is so minuscule.
People lose their minds.
Try to pick a fight with a high guy and a drunk guy.
It's not even funny. And I mean, I guess the benefit of using cannabis culture nomenclature of using something like an indica is you get so stoned anyway, you just want to veg out on the couch and eat a roll of cookies and not go drive somewhere. Like, that's the last thing I want to do when I get stoned, is have to go drive somewhere.
Now think about drunk Canadian and then now high and Canadian. It'll be apologies before you get anywhere.
Yeah, exactly. Oh, so sorry. Yeah, I'd be good at that. It's interesting because, you think of that specific example, and if I was to prescribe treatments for at least 3 of my friends that like to drink alcohol, it would be to stop drinking alcohol and to start smoking marijuana, because you just don't see that. You don't see somebody that's, crazy drunk causing a ruckus. The people outside the bars that are fighting in university are drunk, not stoned.
Yeah.
I want to shift gears just a little bit because you're well known for the anesthesia nerds and everything you've done in that community. And where's the future of that, and how do you intersect this with cannabis? Was there any kind of blowback, because everybody loved you in that sort of genre, if you will, in medicine, and now you're here? I mean, this is amazing as well. It's so you, but do people say that you're going to drop from that? Because I'm sure that you're really busy here. Is there going to be sort of a connection in between? Where's the future for that?
Yeah, again, without making any claims towards anything, being affiliated with the company now, I think the two actually go hand in hand. So half of the anesthesia nerds is anesthesia focused. So making things go to sleep so we can do surgery or whatever procedure on them. The other half is pain management. And I think this fits in perfectly. You know, part of our goal with the anesthesia nerds is education. That's our main goal, actually. And this is a whole industry that people need all new education on. You know, I sometimes feel like I'm banging my head against the wall, repeating myself, teaching people about opioids and safe use of non-steroidal anti-inflammatories and other modalities. This is something that people just have zero concept of. We have to start from scratch. So I think they go hand in hand, and I definitely try not to mix the two different groups, because we do have two very active Facebook groups. Granted, the Veterinary Cannabis Academy is only at like 7,000 members, but it's starting from scratch. But it is definitely a piece of what the Anesthesia Nerds is trying to do as far as keeping animals comfortable and education.
And another turn, we talk a lot about it on the show, and because it's such an active topic about the burnout in the industry and things like that. And I find, you know, I'm a huge fan of technicians, and I rely on them completely when I work as a vet. And then I also find that it's such a sort of a dead end career, because people just get stuck in it, and there's not many people that find so many avenues. And that's exactly what I did with vet medicine, because it's exactly the same. You become a vet, and then day-to-day routine, and you just kind of get stuck. That's why I think that, you know, the suicide rate is up and on all of those things. So can you share a little bit of your experience and just sort of you know, the direction to the technicians that feel like they're stuck in, you know, holding animals and assisting stupid doctors and just, you know, oh, can I say that? Yeah, I can. It's our show. And
it's your show. You're allowed to say whatever you want.
And how to find a path to do something really cool like you're doing in different areas, and just, you know, how to break through and do cool things.
Yeah. So one thing I am steering some of my lectures towards is technicians breaking this glass ceiling that we have put upon ourselves, and then have had organized veterinary medicine kind of install for us as well. And I just want to shatter it. It's bullshit. You know, here I am,
Thank you,
a technician in a doctor's position at a company. This classically would be a veterinarian's position. It just so happens that thankfully, a lot of veterinarians don't know about this stuff, and I happen to know a lot about it. So I was a good fit for the position. And to get away from that mentality, I actually used to threaten to write up my employees when I was a manager at my clinic, when they would say, well, I'm just a technician. That fucking mentality drives me insane. Like, just a technician? That doctor can't do anything without you. You are just the hospital, in my opinion, then, because the hospital would crumble without you. So I just hate that mentality. Yeah, the other thing that I think veterinary medicine needs a big overhaul with are those veterinarians that still underutilized and still don't necessarily value their support staff, whether they're a credentialed veterinary technician or an assistant. You know, they need us, and they need to understand that just because we don't have a doctorate degree does not make us stupid or less than. And then we also need to start praising more and elevating these credentialed veterinary technicians that also hold a doctorate degree, whether it's in nutrition, whether it's in company organization or pharmacology. There are doctor technicians. Hello, I'm, you know, Dr. Stephanie technician person. You know, they could have these advanced level degrees and can be utilized in a more glamorous role than just holding animals or mopping up at the end of the day.
Thanks so much for listening to the Veterinary Innovation Podcast. We're pretty social people, so you'll find us on every social media channel. Also, you can check out our website at theveterinaryiinnovationpodcast.com. Thanks so much for listening.